husband never, ever was sick, ever. Until the morning in the summer of 2009 where he saw blood in his urine. Only 9 days ago, my husband had a radical 8-hour surgery to remove his prostate, his bladder, and part of his urine. Cancer. That's what he's been battling since 2009. Mind you, we moved to Horsham in 2006. Scientists, according to the ATSDR, have studies that have shown an increase in cancer and other illnesses amongst tons of different things that are caused by the exposure with these initials, PFAS. We can talk science and data all we want, and often we get so wrapped up in the numbers and the statistics and the probabilities we forget that there are lives, human lives affected, families watching loved ones go through treatments, getting weak, and some passing away. I am an administrator of a Facebook page called Horsham Toxic Water Residents Standing Together. I post a simple question on that page. Who here is affected with cancer in the Horsham area? I wish I could say that question remains unanswered. I wish I could say it went unnoticed, but it has reached almost 2,000 people with stories that would just make you cry.
Anyhow, 2 years after I moved here, I had trouble walking. And I was diagnosed with Guillain-Barré, which is a disease of the peripheral nervous system. I'm a nurse, by the way, and I have a public health background, master prepared nurse, and I work county level health department. 2 years after that, I started to get better, and then when I was 2012, had more symptoms. And then in 2015, I was diagnosed with MS. Okay, MS. I don't know if it's from our water. I know enough to know scientifically. I can't say it's the water. However, in my neighborhood of 31 people, I know 2 women diagnosed with MS. In a square 5-mile radius of my house, I know of 6 people diagnosed with MS, 2 of which are in wheelchairs. I'm very lucky I'm not in a wheelchair and I'm handling it very well. My sons are healthy, they're in their 20s. My husband is healthy. They drank the same water I did. I also, on my son's lacrosse team of 50 parents, 3 people have MS. I know something's wrong.
Frankly, I've heard agency promises before. It must be said that EPA has been culpable in the ongoing disaster here and across the nation regarding PFAS. EPA knew and stated that it knew PFCs were toxic many years ago when its Science Advisory Board labeled PFOA a likely carcinogen, and West Virginia's concerns surfaced in the late 1990s, revealing broader public health concerns related to drinking water. Attorney Rob Ballant, starting in 2001, worked continually through to today to inform EPA with hard evidence, and despite the C8 panel's verification of human health effects around DuPont's Washington Works plant, EPA still did not regulate. In fact, in 2012, EPA said it would take them until 2022 to 2025 to set a safe drinking water standard based on lifetime exposure. I didn't even hear a date today. Stunning that EPA could move at such a snail's pace while these toxic compounds were escaping into the environment without control and people were getting sick.
2 years ago yesterday, I found out I was pregnant, and we were very excited, and we were also scared because at that point we had learned about the water, and we didn't know what might be in me. Out there is Caroline, my little 16-month-old. And throughout my entire pregnancy, I was so careful. I ate organic, and I wouldn't take a Tylenol for a headache, and I crossed the street to avoid secondhand smoke. The thought that those chemicals were already in me when I formed her, when I nursed her, that I don't know what effects they're going to have on her as she gets older, if she's going to have learning disabilities, if she's going to have so many of the other things I've heard discussed today, is absolutely terrifying to me. And then to realize that we've been told we don't have to worry about these cancer clusters or MS or everything that we've been hearing about from so many people, numbers that we know aren't right. And we've been told don't worry about that, but we know we've been lied to repeatedly before. It's pretty hard to believe any of it. I would be more inclined to believe if you would follow through and do something. We have to pay for increased filtration, but we still can't get testing for our our water systems or our bodies. I want to be tested. I want to know what's happening inside of my body, what might be happening to my daughter. I want my neighbors to be tested. I want more than a couple hundred people to be tested. And I don't think any of us should have to pay for that. We need a new standard of our water right now, of course. And that's a given. People who know more about this than I have spoken about that. But I want to see that we are tested, that anybody who wants it has that availability. And if you want us to start believing you, then prove it by providing the testing.